Hello, my name is Sharmila Paul. I'm a fourth-year medical student at Dell Medical School, as is my collaborator, Shannon Sayyadioskoie. Our project is titled Assessing HIV-Related Stigma Burden to Guide QI Interventions in Travis County. To give some background to our project, Travis County ranks among the top 5 counties in the country for both incidence and prevalence of HIV. The Austin Fast Track Cities Initiative highlighted the HIV-related stigma as a key barrier to reaching their 90-90-90 targets for eradicating the HIV/AIDS epidemic. HIV-related stigma establishes social and structural barriers that hinder prevention, diagnosis, and treatment of HIV while limiting mental health and social support. There's currently insufficient data on HIV-related stigma in the Austin-Travis County area. The objective of our study was to fill this gap and assess the burden of HIV-related stigma within the population of people living with HIV in Austin and Travis County, and we had a particular aim to capture the experiences of vulnerable populations in our community. Our goal was for our data to serve to establish a city-specific baseline for HIV-related stigma, which could be used to design future multidisciplinary stigma-reducing interventions. Now diving a bit deeper into our methods. To assess stigma burden, we utilized a 29-point survey which incorporated a validated HIV stigma survey and a demographic and social determinants of health survey. The HIV stigma survey contained 15 questions assessing the 5 domains of stigma, including disclosure concerns, public attitudes to HIV, negative self-image, internalized stigma from personal relationships, and healthcare-related stigma. Each question was answered using a Likert scale scored from 1 to 5, with 5 corresponding with the highest severity of stigma. Total stigma score was calculated as the sum of scores for all questions of the stigma survey, categorized by severity as follows. No stigma correlated with a score of 15, limited stigma correlated with a total stigma score of 16 to 30, moderate stigma correlated with a score range of 31 to 45, severe stigma correlated with a score range of 46 to 60, and most severe stigma correlated with a score range of 61 to 75. Additionally, stigma subscores were calculated for each domain of stigma. To achieve our goal of reaching vulnerable and underserved populations and attempting to understand the HIV-related stigma burden in Austin, we engaged with a broad coalition of community partnerships, including public health entities, clinics, and local non-governmental organizations for survey distribution. Additionally, multiple modalities of survey development were employed to mitigate language, technological, and literacy barriers. Thus far, the survey has had 29 respondents. Of these respondents, 75.9% identified with the gender identity of man, 72% as a woman, 3.5% as transgender, and 3.4% as non-binary. 44.9% identified as gay or lesbian, 31.1% as straight, 13.8% as bisexual, 3.4% as queer, and 6.8% preferred not to answer. 57.1% of our respondents identified as white, 28.6% as black, 7.2% as multiracial or other, and 7.1% preferred not to answer. 27.6% of our respondents identified as Hispanic or Latinx. 48.3% of our respondents reported experiencing food insecurity, 48.3% reported a monthly household income of below $1,000, 31% reported experiencing housing insecurity, and 27.6% stated that other people's perception of HIV affect how often they attend their medical appointments. Total stigma scores ranged from 17 to 54 with a mean of 35, corresponding with moderate stigma. The healthcare domain of stigma had the lowest mean stigma subscore of all 5 domains assessed. The mean subscore for healthcare stigma was 4.59 compared to other subscores ranging from 6.0 to 8.8. Total stigma score was significantly associated with the influence of others' perceptions of HIV on participant appointment attendance. The findings of this study demonstrate that mobilizing a community network comprised of multiple types of organizations allowed for outreach to a diverse population, including individuals who belong to historically underserved and or vulnerable groups. The demographics of our respondents indicated that we oversampled QPOC individuals compared to citywide demographics. Additionally, our findings demonstrate that HIV-related stigma is indeed present in the Austin and Travis County community, with the mean total stigma score of respondents corresponding to moderate stigma. Furthermore, we found that HIV-related stigma does indeed pose a barrier to receiving medical care to people living with HIV in Travis County. Additionally, we found that a significant proportion of our survey respondents indicated food, housing, or socioeconomic insecurity, indicating that potential QI interventions designed to improve quality of life and medical outcomes for people living with HIV in Austin may target HIV-related stigma as well as social determinants of health. You can see a list of our references below. Thank you for your time.